What's up, YouTube? It's me, Courtney, ECPI RN student, currently technically, today's my last day of acute care nursing. Last day of real nursing classes has completed. I'm super excited about that. I had clinicals yesterday and today, last clinical ever. Oh, it was such a, well, there were other things going on too. So it wasn't like super nostalgic, but it was like I woke up at 4 o'clock this morning and couldn't get back to sleep because I was just like so excited. So I'm like, this is my last clinical ever. Preceptorships. Still have to do preceptorships, just no more clinicals. So let's get into this thing. Acute care nursing. 4 tests, which turned into 5. 3 quizzes, which were all prep use. Drug cards, 3 sets of 5, and Med-Surg ATI. So we can start there. Med-Surg ATI, good God. I know I said before, like pharmacology was the hardest one, and it was very difficult, but Med-Surg, strong second. They're fighting for first and second. That was difficult. It's a lot of information. The book is like super thick. But you need a 68.9 to pass it. And I got a 68.9 on the news. So thank God that's over. The prep you, so for each quiz, we had to do like 3 or 4 prep you chapters. And once you got them done, once you got to level, I think we just got to level 5. So once we got to level 5, that's it. You get 100%, screenshot it was complete, post it to your Canvas shell, the end. The 4 tests that we had class on Monday, Thursday. I had Sims on Tuesdays. I had one random Friday. And, so the Sims, we had 6 of them total. 3 were virtual, 3 were in person. And that was beautiful, having the in-person and the virtual, mainly the virtual. And then the test, so we had 4 initially, but then another one was added because all of us, not one person initially, passed the first test. I think someone even got like a 58 or something crazy like that. And so our instructor ended up adding on an additional test with EKG strips, and we all did really well on that, and that was it. So everybody's grade is up. I think everybody passed. I'm honestly not 100% sure, but I'm about 99% sure that everybody passed in the class. So that worked out great. We had to do our preceptor dream sheet a few weeks back. So either Med-Surg 1 or Med-Surg 2 mod. I had this great clinical instructor one time named Takara Barrett. And I got my first blood draw with her. I got my first IV with her. I got just so much knowledge and information, and she was really good. And she was really like personable, easy to talk to. So I asked her about, her background, and I ask all the CIs about that. All of us do. We ask the instructors, what do they do outside of being a clinical instructor, if anything. And she said that she was actually a internal travel ICU nurse for Centera in Hampton. So I was like, oh my God, can I precept with you? And she was like, yeah. So it was great. So when I did my preceptor dream sheet, I put just her up there, her information, credentialing, location, floor, and then you have to pick 3. And then I picked Med-Surg, and that was like the only 2 that I picked, because like literally you can always get Med-Surg, and that's always available. And I ended up getting ICU. So we found it on Thursday after class. So that was great. And my schedule actually starts with her tomorrow. Good God, no days off, okay? So we have to do 72 clinical hours with our instructors. And I'm super excited, but I'm like super nervous at the same time. Checking my list. The ATI. Got over that. Miss Barrett, preceptorships. Yeah. So Nurse 273 starts tomorrow. That is like dimensions in nursing. And that's when we do our preceptorships. We have a couple classes. Like, I think only 4 classes. Everything else is Sims. I am just super like, oh God, I do not want to. I'm over the Sims, okay? I'm over them. Miss Raj is she is wonderful, very knowledgeable instructor, but going onto campus and, getting somebody to watch my son and all that, it is old and tired. I'm really excited about tomorrow. I will post an update for you all after that. Wish me luck. You all know the drill. Questions, comments, concerns, leave them down at the bottom. Thanks.